kind of wanted to start off as Arlene brings up the slide and just kind of talk about this quote that was shared with me at the White House Conference on Children. This goes back to like 1970, before probably most of us, some of us fellows were even born. But if I can just quote, much has been written and said about racism in our country, yet this crippling process permeates all elements of our society. Unlike racial segregation, which can be at least partially dealt with by direct government intervention, racism is far from being uprooted from the hearts of the American people. It is a social disease that most of us carry. The tragedy is that we are unaware of our subconscious feelings, our implicit bias of superiority and inferiority. To rid this nation of racism, we must bring it to the attention of people, the gravity and scope of this disease, explaining how it has manifested and how it dangerously vitiating the strength of our nation and dividing it against itself. So right now it's been about 50 years since that White House Conference on Children, and what they called for was the development of a program to eliminate racism, which cripples all children. Yet sadly, our national crisis has highlighted we still have a lot of work to do. As we've seen with George Floyd, the Breonna Taylors, Philando Castro's, even here in Monroe County with a gentleman by the name of Daniel Prude. But as our calls for police reform ring out from every corner of the globe, a less publicized but equally urgent cry has been heard for the child welfare system, for reform. So there's been think tanks, there's been advocacy groups, there's been media who have called on child welfare agencies to just examine their existing policies and practices through a racial equity lens, highlighting the glaring overrepresentation of children and families of color involved in the child welfare system. So I would be remiss not to say, well, what we've seen in our nation's capital, that where we were just a year ago, and the climate that we have in our nation, that the time is now to move from conversation to action. So that's what we're going to do here at Monroe County. So as Arlene said, I have been honored and privileged to be appointed the commissioner here at Monroe County. I just wanted to give a little level setting. Prior to that, I was a regional director for the New York State Office of Children and Family Services, where I began my MPLD journey. I was thankful to have leadership at OCFS that pushed myself and my partner in crime, Heather, to apply for the program. And we were so blessed to be accepted as the two New York State girls at the table with the wonderful fellas to just begin this journey. With that being said, you know, working with even my mentor, Mr. Greg Owens, for over a decade, when Greg was the only male of color sitting at the leadership table at the New York State Office of Children and Family Services, way before meeting me and pushing this agenda and trying to get that leadership to understand the need to address the disproportionate minority representation that was occurring at New York State as a whole. So fast forward, here we are. I can also say that this has been full circle because I am now also, with all humility, the commissioner at a county where I started my child welfare career as a CPS investigator almost 20 years ago. So it has totally come full circle. And during my time as the state representative here in Rochester, New York, I was blessed to work with Monroe County for a while, over maybe about 12, 13 years, when we started to pull back the layers around data and think about disproportionality. So fast forward, here we are, and we have this great opportunity, which I'll say again, the time is now, to look at our data, to have some courageous conversations, and to start to think about steps and strategies we need to put forth to reduce the number of children of color that are in out-of-home placement. So just simplistically, my PICO started off with, if Monroe County Department of Human Services changes their practices related to a culturally responsive engagement strategy, such as things that I'll talk about later in the presentation around blind removal meetings, the implementation of cultural brokers, kinship navigators at the onset of services at the front door, Will it reduce the number of African American children in out of placement here in Monroe County? Which led to just our basic research questions, right? So through its processes, practices, and policies, does it come to be that African American children here in Monroe County enter out-of-home foster care placement at rates far exceeding their presence in the Monroe County general population? So just to give you a little background about Monroe County, because I know a lot of times when I say New York, people always just kind of think about the 5 nice boroughs, right? Manhattan, Brooklyn, where I'm actually originally from. But actually, Monroe County is located in Western New York, upstate New York, and it is centered in the city of Rochester. Around the city of Rochester, we have about 19 suburban and rural towns, which we found through the 2019 population estimates. Monroe County is also one of 62 counties here in New York State, which 5 of those counties are just related to, again, the boroughs of New York City. When I talk about it, you'll hear me speak a lot about the Big 10 and Monroe being a big county. So when I think about our state regulated system, because we're county administered, we're considered what the state likes to say, one of the Big 10. You know, so when you think about the Big 10 counties that drive outcomes, drive data, and then, you know, we work so much, and then it breaks down to our large counties, medium counties, and smaller counties. So I just wanted to give a little level setting around there. In our current population right now, 15% of Monroe County residents are African American. Out of those, 73% reside right within the city of Rochester. Our Latino families represent about 8% of the county's total population, with 60% of them residing, again, right in the city of Rochester. So you'll hear me also talk about like some crescent zip codes. So when we started to look at some of the information, although we're such a huge county with so many surrounding suburbs, a lot of our data was being driven right by these 9 zip codes that are located right here in the city of Rochester, which is largely populated by African American, Latino, and a huge makeup of other diverse communities, as we also have a lot of refugee populations and a lot of refugee programs. So we consider a safe haven here. So we're blessed to be very diverse. So where do we start? We started with some courageous conversations, right? So again, with some of the history that I had with Monroe County, wanted to start to think about where we were, right? What the work we had did when I was at the state level, as far as addressing disproportionality, where were we going, and start to think about what our future state can be. So it was really important to kind of do what I like to say, put the mirror up to ourselves and ask the 5 why questions. And in doing so, because anything you're talking about race or, you know, disproportionality, disparity, finding ways to build a safe space and starting with our leadership team to start those level setting conversations. And a lot of it started with just basic terminology. So we started to talk about structural racism and started to unpack, right, some of the, if I could say, some of the myths. This slide was adapted through Aspen National Services, through the Aspen Institute Roundtable, and it really speaks to some of the thought processes that we were experiencing when we were talking about some of the information and just having basic conversations on the why. Why do we believe that there's disproportionality in our county? And structural racism and race was a side conversation. We heard things about poverty. We heard things about the individual and family behaviors. There's not enough appropriate permanent homes, for example, and levels of support. And then race became, and structural racism, like this side conversation, right? This side initiative that we needed to address. But then when we started to talk a little bit more and we looked at it even further, we came to the agreement that structural racism was in the center and how that may lead into some of the poverty, the supports, the behaviors, and the access to appropriate homes. How are we going to use this racial lens now to embed it in every decision-making point in child welfare? So that's how we took that and we started to apply that in our conversations, putting structural racism and race right in the center of all of our conversations going forward. So yeah, so coming in, right? I'm a big fan of Stephen Covey. Covey has, a wonderful book. If you haven't read it, it's called 7 Habits of Highly Effective People. One of the principles that I tend to use a lot, especially coming into a new role and knowing that I don't know everything, right, is that seeking to understand and then you seek to be understood. So I had promised myself coming into this new role, although I had a lot of history from the county, I knew some of the data from the state level. Let me come in and as a new leader and try to seek to understand what was contributing to the data of disproportionality. So in that, we did a few qualitative and quantitative data reviews. Around some of the qualitative, it was basic conversations, having conversations with our department leadership, thinking about engaging in conversations with our community partners. And we could not be remiss about our judicial partners. We were blessed here in Monroe County to be part of what we call a court improvement program. So it was really important for us, as we had a lot of the conversations internally, is to also have those conversations with our partners. We needed to have a better understanding, right, of issues around just our local data, our department structure, and the missions and the directives of our department as a whole. Then we moved to to quantify some of that. So we did some case reviews. We did about a 50 case review. We used an instrument that we have here at New York State. It's called the Ongoing Assessment and Monitoring Tool. And that's just a tool that just kind of reviews every decision-making point, every regulatory requirement from soup to nuts, from intake all the way into placement into the foster care system. We wanted to examine the effectiveness of some of the qualities of some of the CPS interventions with a specific lens to our African American children and families. I was particularly interested on how caseworkers were engaging with families and how those engagement interactions were documented, because it really gave a lot of lens into if we needed to do some work around being more culturally linguistic. And then what knowledge is gained about the family through a culturally responsive lens. So a lot of information that we were gathering there was eye-opening. If I can even say, even looking at the New York State tool, there weren't a lot of questions around race and ethnicity. We talked a lot around, just some of the anecdotal things that were coming out through the reviews, and not a lot of documentation to support that. We were even engaging in families in a way where they can self-identify and speak to, right, their culture, how the dynamics in their own home. Many folks that know me, I always use myself as an example and try to push that with our team, is that if you walked into my home and I had a child welfare case, and you went back to your desk and you had to click the buttons, right, and decide what type of services and things I needed, from face value, if you didn't engage with me, you would think that, I'm going to go back in and I'm African American and possibly give her African American type of services, while I am 100% Latino, Central American from Panama, and I would want some additional services that related more to the needs of my family. So we had all of these courageous conversations about engaging families and looking at the data differently. As we continue to seek to understand, it was really important that we got the lived experience, right? We got the voice of families, both bio, foster parent, and relative resources. So we had a listening session. And it was just kind of designed to seek the range of perspectives on how is the system working for families. In child welfare, we don't send out a lot of surveys around how did they receive our service, or were they satisfied, right, as their customer, right? We take a lot of that on our own. So we needed to gain a better understanding of just what was occurring at various points of the child welfare system. And that for us was what we call the State Central Registry. That's our hotline here in New York State. So from the initiation of a CPS investigation, to possibly the need for services, to possibly the need for a removal and a placement, and then how does that fare with children that have been removed and their lengths of stay to move towards permanency or reunification. Going further, we want to burn the candle on both ends. Not only do we want to hear from our families, we also want to hear from our staff. So we have about 248 surveys that went out with about a 60% return rate. And the staff survey was just designed to get a better perspective of our frontline workers, to obtain their reflections, kind of get their perspective on their observations of their work. And it prompted a lot of organic conversations related to disparity. And you know, it served as for us to start thinking about what our training needs are that I'll speak to later on in the presentation. And really just kind of getting the information from the staff that were out in the field on a daily basis, interacting with our families and their perspective, which was so important. So as Sherilyn will say, we trust the data, right? So we use our data to identify disproportionality and disparity within our programs. And the goal was to kind of use that to map it back to our own internal policies, assistance procedures that could possibly be contributing unintentionally, right, to disparity and disproportionality. So as I mentioned, as I'll talk through the placements around our African American children of color, but it was also important to me because when I think about children of color and I think about our indigenous families and I think about our African American families and our Latino families and our refugee families, one of the things that the state does track is that they also track the disparity for our Hispanic children. And in 2019, Monroe ranked an extreme disparity with the ranking of 22 out of the 64 counties that we have here at a disparity ratio of 5.2. So for disparity, right, for every one Latino or African American children per 1,000 of their white counterparts in the general population. So we were bringing in children, Hispanic children at 5.2 rate higher than their Caucasian counterparts. So I actually love this graph, and this is specifically for Monroe County. I think it just kind of really underscores some of the conversations that we were having internally and really understanding what was the population makeup and how we were gearing around disproportionality at different key decision points in child welfare system. So as you can see from the graphs, really simplistically, African American children right now in Monroe County make up 21% of the general population here. But at each decision-making points, there's huge disproportionality. So from intake through our state central registry, we represented at 39%. And indicated reports, meaning that the report came in for whatever allegations, we found some credible evidence to substantiate that report. 42% of family of color are being indicated. 54% receive preventive services, 43% enter foster care, and right today, 51% remain lingering foster care at a disproportionality for our children of color. So as we also looked at the data from Monroe, we started to drill down just a little bit more, right? And we started to look and see at different decision-making points. So it was interesting for us to see that at the time of this data pool, we had 547 children that were placed in foster care. 75% of those children were children of color. In our protective cases, meaning that there was enough that we have a court order and we have families that are mandated for services and require child welfare intervention under what we call our CPS Management Teams. 86% of those cases are children of color, 175 out of 204. The disparity is just extremely glaring. As we talk about our direct placements, we call these here in New York State 1017. So these are children that are placed with relatives, but still under a court order and still requires child welfare involvement. Out of that, we have 309 children right now placed in direct custody. 239 of those children are children of color. So we continue to ask ourselves the why. So as we continued on with the journey, with the listening sessions, with the breaking down the data, we're trying to understand where we are. We used that data to really start thinking about which direction we were going in. What policies and what practices can we utilize to help inform our decision-making going forward? What could we put forth to reduce our disproportionality numbers? Can we believe that families were going to be seen as partners and not seen as them or the other side of an adversarial system, which is a direct quote that we got from certain family members as well. We also looked at information through the Child Welfare Information Gateway. As I was reviewing policies, the tools and the information that I got through MPLD, we had one whole section of learning to address disproportionality, which a wonderful disproportionality assessment tool was shared with us that we are utilizing to look at our policies and practices. As a commissioner here, even looking at contracts, and as we contract with our stakeholders in the community, are we talking apples to apples? Do they have the same belief that we have? Are we building in language in our contracts around racial equity and addressing disenfranchised communities of color? We looked at the policy development tool and the policy template that was shared with us through MPLD, which helped us so much, as I'll talk later in the presentation, around some of the policies that we have put forth thus far. So just in a nutshell, we're looking at trying to promote racial equity in all our programs across the board. Many of us child welfare leaders and work in this field, we know tons of strategies come down. And sometimes, even at that seat, I feel like an initiative or a strategy will come down and, it's like the spaghetti we throw at the wall to see what kind of sticks. I wanted to ensure that the racial equity work was not seen as just another initiative, right? Another flavor of the month, but more as a lens of how we do our work across the board to just achieve that equity for our children of color across in our out-of-home placements and our CPS investigations that are freed for adoption, the whole gamut. So we needed to look at that. We needed to talk about the partnerships that we did have with our members, including tribes, our parents, our families. It wasn't just a one-stop shop. Then we started to think about how could we change practice and what could we put forth? A lot of the information that we got came straight through the listening sessions. It came from some of my previous experience working with the state, long time coming, right here in Monroe County, going way back to 2008. The state had put forth some pilot funding to address disproportionate minority representation. And here we are, 2021, and still trying to move the needle to create better outcomes. So again, just moving it forward, and we needed to be courageous to take that first step. And in doing so, and working on my ARP, really utilizing a lot of information that we learned through implementation science. And if we were trying to mirror it so we could also follow a continuous quality improvement process. Wanted to, understand what were some of the underlying issues driving our data, thinking about what strategies we could put forth to address that. Of course, we want to know what are our organizational drivers? What does our leadership look like at the table? What are their beliefs, right? How competent are we? Do we need additional coaching, training? All of those things. And as I was working through my project, Sherilyn kept me very focused on staying with the implementation science and utilizing the template to map out those steps, which, if I can say, has been tremendous in not only just guiding the conversations and memorializing them, but to level set our staff here. And step by step, we continue to fill in that template as we continue to move on with our journey. So originally, there was so many comments on the route we needed to take, right, from our staff and what their beliefs are. The basic premise was we were going to meet people where they are. There were so many folks that were, if I can say, at different places in this journey with us. Again, we had a lot of staff here that was part of some of that work that was done in Monroe County going back to 2008. So I wanted to build on those champions, right? Quickly learned that a lot of those champions were de-energized. The data remained the same. It seemed like strategies weren't moving forward. So we had to meet people where they were. We have a lot of new staff, as we know, in child welfare, retention and recruitment is a continuous effort. So as we continue to train and get the information out, how are we going to make this sustainable? We needed to raise some awareness around implicit bias, needed to start to think about what those mandatory trainings on racial equity could look like. And then our ongoing commitment, right? That this was not going to be a one and done. And what we had learned thus far is that it needed to be a standing agenda item at every meeting, at every conversation in the forefront, that we were looking at strategies, we were looking at outcomes, and ensuring that at every given time, we were utilizing a racial and equitable lens. Lots of recommendations came from the listening sessions. We got wonderful recommendations from our New York State Office of Children and Family Services. I got some great recommendations from my mentor, Greg Owens. And ironically enough, a lot of frontline staff that have been engaged in some of the racial equity on their own personal time. They belong to community-based organizations, so they were able to bring to bear a lot of things that we could think about. We also wanted to think about the makeup of our community, to learn a little more about our LGBTQ community, possibly our refugee, Somali and Haitian population, and as well as working with our sexually exploited youth, which as we were looking at different systems, this disparity and disproportionality was across the board. And then a lot of conversations came from the staff around it's the front line, right? It's the mandated reporters that drive our disproportionality, and having them understand that once a child enters the child welfare system, at that call of intake, the further they engage in child welfare, the further the disproportionality occurs. So we needed to use that data from the listening sessions to think about how are we going to educate some of our mandated reporters. When we drill down on the data, majority of our cases that come in are coming either from some of our own community-based partners, from the schools, from the hospitals, and at times law enforcement. It was very evident through our listening sessions that there was a need for more foster parents of color, and that we needed to educate and prepare our white families that were getting children of color. Basic comments were coming, if I can say, which sometimes was hard to hear, or the staff felt that it was hard to hear. We had foster parents and bio parents literally call our system racist. They felt that white families were treated better. I had one young lady tell me that the system is racist. I should have never been removed. They just needed to help us with services. Poverty. That's the reason why children come into care. White families are treated a lot different than our African American families. They tend to look at those families differently. They get more supports. Kids seem to linger in my home for 2, 3, 4 years. They're good enough for me to foster them, but they're not good enough for me to adopt them. So those were just some quotes, unquotes, that we got from our listening sessions. So we needed to, again, move to the belief. And this was one of my beliefs, that race was not going to determine the outcomes for our children and families here in Monroe County, and that our removals needed to be comparable to demographics of our community. But how were we going to get there, right? What were we going to do to ensure that was going to happen? So again, this is like one of my favorite slides. When I started with my racial equity journey and trainings, my mentor, Greg, he would always talk about the difference between equality and equity, and how it's so important for people to understand the difference, right? And the assumption that everyone benefits from the same supports, that's equal treatment. But when we give the supports that they need, how do we move to equity? And then when we remove those systemic barriers, how do we move to justice? So I wanted to just share that slide because I just think it's really powerful. So one of the strategies that I am so proud to introduce and have worked with our state partners on for many years is the introduction of blind removal meetings. So if I can just say that the blind removal process It has been shown to be an effective strategy in reducing racial disparity and disproportionality in child welfare. Again, I was privileged to work with Nassau County, that's located in Lower New York, near the Long Island area, and their Department of Social Services, when they started to think about blind removal meetings. The key feature of the larger blind removal process was just to create a facilitated and unbiased decision-making process in which a caseworker does not disclose any personal and demographic information by the child and family when the information is presented to directors, assistant directors, and others that do a removal when a removal is initiated. In this way, the discussion is focused on the factors related to safety and family strengths. The goal of the blind removal process is to have unbiased decision-making in the removal process while still maintaining child safety and reducing the risk of harm, decrease overall number of children removed, and resolve disproportionality of race in removals. So, unfortunately, removing children from their homes is sometimes necessary to keep them safe, but placing children with relatives and adults with a positive relationship to the child or children, our kinship caregivers, is preferred anytime over a non-kinship placement for so many reasons, including maintaining the family and cultural connections, preserving cultural identity, reducing trauma, and providing a more stable placement for children who must be placed in out-of-home placement. So real simple, when we started to think about bringing together, we created a core team that started to address blind removals. They were able to reach out to Nassau County, learn a little bit about some of the barriers, the stumbling blocks Nassau had with putting some of this forth. And then we just got quick to work. I also was very blessed to reach out to what I call a sister county here in Buffalo, New York, Erie County, who also has a huge disproportionate minority representation data, to see if they were willing to partner with us, right? How great is that for staff to learn from each other, and that we could take this journey together. And if we could get 2 large counties here in New York State to do this and do it well, wow, what the outcomes would look like for Western New York. So that's just some basic information of what needs to be gathered prior to the removal meeting. The blind removal committee meeting really just is that multidisciplinary approach where we bring together our child welfare directors. We'll have our agency attorney there at the table to ensure that we're meeting all the legal and regulatory requirement. We'll have our case planner and preventive worker in the event that the family does not have to come into care, that we're going to make sure that before we leave that table, we wrap that family around services to sustain that placement. Something else new that we're bringing to the table is what we're calling our kinship firewall, again, to ensure that if a child does have to come into out of care placement, we do not leave that table until we explore all kinship relative resource. We heard earlier in the presentation, the definition of kin has changed. So we can even look at our victim resources, anyone that the child of the family can identify as having a significant connection to them. Again, we'll have our family engagement specialist there at the table to think about what that would look like if we needed to create family team meetings with the family. And, unfortunate, as I said before, the reality of our work is that sometimes situations are unsafe and children are in imminent safety, and we need to bring them into foster care. So with that being said, we will have home finding there to make sure that we're doing our best to match that child with the most appropriate foster family, and that the assigned foster care unit supervisor and caseworker, if needed, is also there. So we're having consistent conversations across the board and making those next steps around decision-making together. Oh, really quickly, another strategy that we were looking at is just kind of bridging our cultural divide. What we heard a lot from the listening sessions is that we needed that lived experience at the table with us every step of the way, in our policy development, in our practice development, and using our cultural brokers as members of the community that could advocate for families and navigate through the child welfare system, helping them understand skills, parenting, what are the supports in their community, understanding, what they needed to do to move towards out of the child welfare system, those protective measures that needed to be put in place to create those formal and informal relationships. So once the child welfare system, which is our hope, are out of families' lives, they have these connections that they can go to sustain. Additional identified strategies, again, organically with the conversations, things just started to bubble up that made us think of outside of just, blind removal, cultural brokers, kinship navigators. We started to think about what was our own agency, values, and principles, and looking at our mission statement. So we're working on creating a different mission statement, not just for Child and Family Services, but for my Department of Human Services as a whole. Needed to think about expanding our service options and developing a strategic plan, right, that we could utilize across the board to ensure this equitable practice. What was going to be our desired vision? How did we envision practice looking going forward? If we had one wish to reduce disproportionality, what would that look like? So yes, so now my leadership lessons learned. Oh my God, I learned so much through this journey. How there just needs to be like just equal voice at the table when we were going through this work, how it's so important for us to look at the policies and disparity. We got pretty stuck sometimes in our conversations around the regulatory requirements, but understanding how regulations drive policies that drive practice and how we all bring our own lenses to the table and how implicit bias feeds into the decision-making process. And we needed to pivot from like a cultural competence framework to focus more and building our intercultural capacity. So the impact of my MPL journey, I can just say it was right on time. I had so many moving parts. It was amazing. I can say that when the first cohort was introduced, the Sherry over at the Children's Bureau reached out, and at that time I was being promoted to be the director, and I just didn't have the time. I was like, I can't do it, Then I get into the director position, and the opportunity presents itself for a second time, and I said, okay, this is Guy. I had no idea that I would be promoted to a commissioner, and when I tell you, just like Adrian, I spoke so much about this leadership development, and it was one of those things I said, listen, I am committed to one full year of this program. So you guys are going to have to support me as I come in the middle of a pandemic to help work with this with this county. And I must say my leadership has been actually absolutely phenomenal. The opportunity to learn, to network, to create these friendships with this phenomenal group of minority leaders across the nation. Arlene, Sherilyn, Max, you're not about to have me crying, but I have to say, this has been one of the greatest journeys, and I can't thank you guys enough. Like, the transition to the new position. I lost a few family members this year. The supports that we're giving, the flexibility, just sometimes in our one-on-one sessions, the ability to just kind of vent and, driving Arlene and Sherilyn a little crazy sometimes. 1 hour meetings turned into 2 hours, and Sherilyn's constantly trying to refocus me back, which has been great. I've learned that leadership is not about titles or positions or flowcharts. It's about life really just influencing another. I'm hoping that this impact of my ARP will create such better outcomes for not just our children here in Monroe County, as we work with our partner county in Erie County, and as we also create a piloted model here that the state, right, New York State can look at to implement across the board. Also, really excited that, on the state level, they've recognized that blind removal meetings, the importance of kinship, should be at the impetus of the work that we do, and have created administrative directors for our counties across the state to look at their data and to create policies and protocols to address DMR. So this has allowed me to create a platform to continue to bring awareness to the blind removal meeting process. It has definitely sharpened my skills in data analysis, engaging in courageous conversations. And anybody that knows me, just leading from heart, just, sometimes too much, but leading from heart. And no matter the state, no matter the country, let me tell you something, this DMR is across the board. And one of the things that I've learned so much from the beginning of 1970, from the White House Children's Conference, is that our data has not moved to a certain degree. So I just want to thank everyone. I got a couple of special shout outs, if I may. I want to thank the Children's Bureau, Spalding, Adopt Us Kids. I want to thank the New York Office of Children and Family Services. I want to thank my county exec, Adam Bello, my deputy county exec, Corinda Crosdell. A special shout out to Arlene and Sherilyn. And a special shout out, where I'll probably get emotional, to my mentor, Mr. Greg Owens, that not only through this MPLD, who has been my hero in this work for almost 2 decades, and Team Elevation, my MPLD fellows, we did this, okay? And I am just so proud of each and every one of us. And guess what? We get to put the bullet on our resume. We led through a pandemic, all right? Okay. So I probably over time, but thank you so much for allowing me the opportunity to present.